In today's lecture, we're going to look at childhood, genetic, and developmental diseases. First, looking at genetic pathophysiology and the role that genetics plays in the formation of certain disease and pathologies. So genetics is kind of the basis for how many diseases work. We know that there's a huge family history component to a lot of disorders and a lot of diseases, and there's a greater disposition that some people have based off of their genetic makeup, things that we can't or have no control of, and something that we currently can't change, and just how we're made or what we have inherited through our mother and our father. So, looking back at the basic anatomy and physiology and genetics of that each person has, we are born within our cell nucleus of most of the cells in our body, excluding a few of the cells like red blood cells. You have a cell nucleus, and on the inside of the cell nucleus, you'll find 48 chromosomes or 23 pairs. You will receive 23 individual sets of chromosomes from your mother and then 23 from your father. Somatic cells reproduce through mitosis. So these somatic cells, these are most of the cells that compose our body. So muscle cells, bone cells. If the cell is looking to replace itself or to replace it being damaged or old, it's through this mitosis. Now, through germ cells or sex cells, they reproduce through meiosis. This is a haploid cell carrying 23 chromosomes. As in a somatic cell, each one of those cells, when they divide, they will all carry those 46 chromosomes or 23 pairs. We want these sex cells to be haploid, so our children will then have 23 chromosomes from us and 23 from our partner. Normal females, the sex chromosome, which is the 23rd chromosome in each person, is you receive an X from your mother and from your father. An interesting note with females only donate an X. So every egg that they produce has an X because they are XX with all of their chromosomes, so they can only donate an X. So the determining factor whether someone is born male or female is dependent upon the male sperm, whether it is carrying an X or a Y. Normal sex chromosomes for a male is an XY. Chromosomes can be visualized by karyotyping, and so it's just a technique to view view the images of the chromosomes easier. And sex chromosomes can be evaluated by buccal smear or just the swabbing of the inside of the cheek. X chromosome is much larger than a Y chromosome, carries more genetic information. Chromosomes are made of DNA monomers in a specific order, and specific coding sequences on a chromosome equals a gene. So you may be wondering what the difference between a chromosome is and what a gene is. So there are 23 pairs of chromosomes, so we're looking at one chromosome here. Let's say this one's from your mother, this one you got from your father. Certain sequences within that chromosome that codes for a certain thing. So let's say on this one, this is showing a gene that is responsible for the eye color that you'll have. And so this sequence will determine that you have brown eye color, and then this will determine another maybe dominant trait. And so the entire chromosome itself will have multiple things that it'll code for, but along that code, you'll have certain sequences that code for different things. So maybe this one right here is coding for the hair color you have, and then this allele or this gene sequence is, let's say, for blonde hair. And so the variety that we get in the specific phenotypic view that we have of people are determinate based off of what is in this genetic code that we all have. Chromosomes, one from each parent, pair up during fertilization. Homologous chromosomes have genes at specific loci, meaning that you can see here that the one that we see from our mother and our father will have these genes at these same locations along their chromosomes, and then have alleles of a gene at the same locus. And those alleles are different versions of that gene. The law of segregation, humans are diploid, meaning they have two alleles of each gene, one copy from each parent, and that's different than our sex chromosome, our sex cells, which are haploid, which are the only haploid cells that we have in our body. When that individual forms gametes, they will be haploid with one allele of each gene, and the alleles that an individual has will be divided evenly into gametes they form. Here we're looking at some genotype. So if you remember, a genotype is a characteristic being represented by either a capital or a lowercase letter, which is showing a specific trait. So let's say, again, we'll just keep the example of eye color. And let's say this is showing capital P, and so the parent genotype can either be, let's say, having two capitals means that the dominant eye color is brown, and a lowercase p is the recessive and more rare type of blue eyes. So a parent genotype could be that someone has, from both their parents and in their genetic information, their chromosome, from both parents, they have two P's and two dominant brown colored eyes. Well, all of their gametes are then going to be 100% of this dominant color. They can only pass this on to their children and nothing else. Someone who maybe has a parent with brown eyes and then one with blue eyes could have a split. So when their gametes form, 50% of them will be dominant brown and the other 50% will be the recessive blue. If you had a parent or an individual or two parents who had both have blue eyes, then they would both have the recessive trait, meaning all of their gametes would also carry that recessive. And so you can see that since you're receiving one of these letters from, let's say this one is from your mother, so you get a capital dominant P, and you get a recessive lowercase p from your father, that forming together would give you this more mixed sort of hybrid in which the person would show that they have brown eyes, if this is what their genetic makeup was and their chromosomes, but they would also be a carrier for blue eyes. So they could potentially pass it on to their children. If we look at Mendelian genetics, each gene in an allele can be dominant or recessive. Homozygous equals matched alleles, and that's that example that both alleles that you have are either dominant or both are recessive, but they match each other. Or they're heterozygous, meaning they're unmatched alleles, and that's that mixed one capital, one lowercase. The gene complement, meaning like this breakdown, would be the genotype, and their expression, what we actually then see. So whether a person has brown eyes or blue eyes or whatever the physical trait is referred to as the genotype. Genetic pathology. Abnormalities can be due to chromosomal disorder, genetic disorder, environmental factors, which then could impact the genetic sequence itself, or a combination of above. Individuals acquire abnormal genes in two ways: either through mutation of gene during meiosis. So as the you're forming these gametes, there could be some sort of mutation along that pathway, which then causes a potential genetic problem for the offspring, or a passage of abnormal gene from the parents. So through that heredity. Genetic disorders are passed to offspring in four ways. So they're either autosomal dominant, autosomal recessive, sex-linked dominant, or sex-linked recessive. And so these are slightly different in the source of it and the way that they present. The difference between the two is that an autosomal is one of the chromosomes between 1 to 22. It's just not one of the sex chromosomes. So it could occur on the third chromosome or fifth chromosome or whatever. A sex link would be directly related to either the X chromosome or the Y chromosome. A autosomal dominant means that you receive a particular genetic disorder from both of your parents. So you receive this trait from mother and father. Autosomal recessive, meaning that you're receiving it from just one of them. Same thing for the sex-linked. Sex-linked dominant, meaning that you are receiving both of these from your parents, and sex-linked recessive, you're receiving one of them. One of your parents passes that information on to you. Genetic disorders are passed to offspring in four ways, as we just said. Looking first at this autosomal dominant. So if an allele causing Huntington's disease, this disorder, is dominant to the normal allele, what offspring would you expect from an HH lowercase h cross? So if you look at this, if you're looking at this Punnett square, what you'd want to do, and let's see if I can get mouse up. Okay, so what you want to do with this Punnett square, and it doesn't matter which one you start on. So let's say we put the H, the capital H here, and then another capital H here. And so that's for this very first one. And then for the second one, you would write the other genotype on that side, H, and then a lowercase h. And these four squares are representing four different possibilities of what you will see in their offspring. So what you'll do is you'll start. I usually like to start with this one in the left, and then I go across. So with this one, you would combine it with this one just adjacent to it. So in that case, what you'll see is HH. Same thing here. So HH. Now we'll come down here to the second one, and what will this genotype show? And you can see that the lowercase h will combine with two different capital H's. So the genotype will be a capital and a lowercase for both. So to answer the question, in this case, since the Huntington's disease is dominant, that means all of the people in this case will have the disease or the disorder. It's dominant. So it doesn't matter if they have two of them or just one of them. It's dominant. So all of the people in this case will have the disease, though two of them will be a carrier for the normal allele, but all of them would have the disorder. Okay, so um, slightly different view here that kind of pass on information. I'll see if I can try to clear that off. But clear all drawings. Okay, and so I'm not going to draw through this one, but we can get an idea from that previous one what it would be. So let's look over it for this autosomal recessive. So let's say if an allele causing cystic fibrosis is a lowercase c, meaning it's recessive to the normal allele. So if it's autosomal recessive, in this case, you have to have two copies of the recessive allele in order to have the disease. You'll be a carrier for the disease if you have a lowercase c, but you need two of them to actually have it. So if we look at this cross, so let's say we put the big C here and a big C here, it's really the same breakdown. In this case, so you have a uppercase here and uppercase here, and then another uppercase here, and then the lowercase right here. What you're going to see if you did the cross is that all of them would have none of them would have the disease. And then two of them would have both copies of the dominant normal allele, but two of them would be carriers, so they could potentially pass it on to their children, but they wouldn't have the disease themselves. Okay, now let's look at sex-linked recessive. If an allele causing color blindness is recessive to the normal allele, what offspring would you expect from from this particular combination? So what it's showing here is that the X, they're getting this dominant one from the X. You're getting this right here should actually be a C, not an O. What you're showing here is that you're getting a slightly different combination because you're looking at both factors, one from the female, one from the male. And if we'll go ahead and work through this one. Okay, so if we look at these, we get a normal allele from our mother, and we get a colorblind or abnormal allele from our father. That is Y linked. Get the same thing for the other one, so we get a cross. So we get the uppercase, and then we get a lowercase. So if we work our way through this, you can see the first one. Not only are we looking at, so if we're in this case, if someone does not have color blindness, we're also looking at which chromosome they got it from. So in this case, since they're both the uppercase, we know that this person not only is not colorblind, they're also female because you had to receive the X from both your mother and your father. So if we have this next person with a uppercase C and a lowercase c, this person, a little bit, it depends on where the combination is coming from. So if we were to distinguish, this was, let's say this top one that we're showing across here, this first one is the male, and this bottom one is the female. So in this case, this person would be a male who was not colorblind, but did carry the colorblind gene. Okay, now we'll look at this bottom one. You have both, so this person would be colorblind. No, sorry. So that first one, kind of the same thing as this. They would be carrier, but not colorblind. And then this bottom one here would be colorblind. So you can see that 3/4 of them would be normal, and 1/4 would actually have the color blindness. The Punnett square is a nice, simple way to look through and kind of track certain alleles. And it can get a little bit more complex when you start factoring in multiple alleles at once. But these simple Punnett squares, where you're just looking at one characteristic, is a nice, simple way to track a disorder. Okay, so some specific genetic pathologies. We also have ones that have this incomplete dominance, one of which is this hypercholesterolemia. So you can see that the phenotypes down here for this particular disorder, the person could be normal in their homozygous for the ability to make the LDL receptors. And so their genotype here is normal. They have two normal alleles and everything functions correctly. A mild disease, you would sort of have a mix between a normal allele and then you can see the recessive disease leading to this hypercholesterolemia. Now, since they have one normal allele, they function better than someone who has both, but they do show signs of the disease or of the specific pathology. And so the normal allele in this case will be referred to as having an incomplete dominance. Unlike brown eyes, which you either have brown eyes or you don't, that would have a complete dominance. In this case, it's only a partial dominance or incomplete dominance. And you see here that having both lowercase or homozygous for the inability to make the LDL receptors is this severe case of this pathology. Codominance. Codominance means that you have two particular, in this case, it's showing antigens or these surface proteins on red blood cells, in which you have multiple alleles for one gene, but neither one is recessive to the other one. So if you think about your own blood type, they fall into four main categories that we typically categorize them in. So we have type A, type B, AB, and O. And what that's saying is that if you are type A, you have the A antigen. If you're B, you have the B antigen. Some people, and this is a little bit more rare, but there are people who have AB, meaning they have both antigens. They have a codominance with each other. And then type O, which most people are type O, you don't have either surface antigen on your red blood cells. And so what this one, don't worry too much right now about trying to memorize this chart. But basically what this is showing is that if you are something, you will have antibodies that will be against what you're not. That may sound a little too confusing, but remember, if you're type O, you don't have either antigen on your red blood cell surface. So you have antibodies against A and B because they don't belong in you. So if you received a type A blood or a type B blood, you have antibodies against that would then attack that specific blood. They wouldn't mix well and it would form a huge blood clot. Type A would have an anti-B because you wouldn't, these surface antigens are not you, so that's what your body would attack. Type B blood would have anti-A, and then someone who has a type AB, since that is normal for their physiology, they wouldn't have antibodies for either. Now, obviously, and some people have asked this question, obviously, if you think back on antigens, no one has a anti-O antigen because O, in this case, you can think of almost as zero because they don't have a surface antigen. So you wouldn't have an antibody against an antigen that doesn't exist. Okay, polygenic. Certain pathologies that are polygenic, meaning that they come from multiple genetic sequences along, they could be on different chromosomes even, but they come from multiple sources. Such diseases are hypertension, coronary artery disease, diabetes. These are pathologies you will see with a large percentage of your patients. And the reason why they're so prevalent is because they are multifactorial and come from multiple alleles. Looking at now at pleiotropy or epistasis. Well, it's not providing a definition, but pleiotropy, what you're getting with that is this is where you'll have the production of a single gene of two or more apparently kind of unrelated effects. So you will have one allele, which will then have more than one effect or more than one outcome. Epistasis, the interaction between genes is antagonistic. So like one of the gene masks or interferes with the expression of another. An example may be like pigmentation in mice in their color, or in like flowers. So they may show that they certain mice may have brown coat color, other may have white. You with their offspring, all of their offspring may just have the dominant brown. So it's sort of masks the genetic or the genotype that they also have white color code in their genetics. Approximately 2% of newborns are born with congenital anomalies. 60% unknown cause why these occur. 20% could be genetic. 10% chromosomal issues. 10% could be environmental factors such as pollution or and other things. So some diagnostic testing that they've done to try to detect some of these malformations. So they're, I know this is commonly done with Down syndrome, which is having an extra, there's one extra chromosome on their 21st chromosome. So a lot of times you'll hear this referred to as trisomy 21. This can actually be detected before the birth of the child. So some of the diagnostic tests they can use is fetal ultrasound, detects malformations. Amniotic fluid reveals genetic and chromosomal information. So if they take a sample of that amniotic fluid, and maternal blood, abnormal fetal substances circulating cell-free fetal DNA. Some genetic pathologies which affect the muscles, one you probably have heard of is muscular dystrophy, and there's a few different types of muscular dystrophy, but just in general, it's a genetic degeneration or weakening of muscles. The most common type is Duchenne's muscular dystrophy. It's caused by a sex-linked disorder, passes mother to son, and being passed this way, because it's the disorder, if you think about it, it's mother to son. So you'll only have males who have muscular dystrophy, who actually have the disorder. But because it's on the X chromosome, the underlying pathology of it is passed from the mother to the son. Now, a mother will obviously can and does pass it on to her daughter, but the daughter would have a healthy allele that was provided from the father because she has two X chromosomes. So you can see because of this disorder, you'll only see males with muscular dystrophy. Symptoms onset between 2 and 5 years of age. Other things you'll see is a waddling gait, kind of like a back and forth, almost kind of like the same way you may see with the way a penguin walks. Toe walking, which is common with a lot of neurological problems. Lordosis, that's this excessive or exaggerated curvature of the lumbar spine. And then Gower's maneuver, what that is it's a technique which was found through observation and evaluation of patients. It's a way that if you had them on the ground or on their stomach and you told them to stand up, they would stand up, and the only way they'd be able to get to an upright position is that they would have their hands on their legs, and they would have to then kind of push themselves up. So it might be good for me to I'll look up a picture, and it'd be good to kind of look at that and see what that Gower's maneuver is. So you can see here, like what I was saying, if you have them lie down on their stomach, and then you ask them to stand up, they will stand up in this pretty typical for the pathology maneuver, in which they will kind of push themselves back with their hands. And as they come to their feet, they'll hold themselves up on their knees. And it's because of the weakening of their muscles that they're unable to do it kind of in a more normal or typical way. This particular technique is referred to as a Gower's maneuver or Gower's sign. So for the treatment, there's no cure for it, but use of physical therapy or orthopedic devices and exercise can and is helpful. Congenital hip dislocation. It's abnormal joint resulting in a femoral head slipping out of normal position. Cause is an improper positioning in the uterus and maternal hormones. So there's sort of this lack of development of this normal ball and socket joint that forms, and so the hip easily dislocates when the child is born. Symptoms: asymmetrical folds of affected thigh, difference in leg length. Obviously, if the hip is dislocating, you're going to be moving the whole leg out of position, so you will see differences in leg length from one to the other. And then a limited abduction, also referred to as this Ortolantes sign. And so they will have limited, if you take their hip out to the side, because it's dislocated or easily dislocated, it's not going to abduct normally. Treatment: closed or surgical reduction of the femoral head. So you can do this either through bracing, which is sort of the more common, or if it's more progressed, then there could be surgical intervention. Clubfoot, also known as this Talipes equinovarus. It's this clubbing of the foot, almost a complete turning in of the ankle. Common congenital abnormality of the foot. This is very common. Cause is unknown, but it could just be positioning within the uterus, the way that it's pushed up against the wall of the uterus. And so it develops this classic club sign. Symptoms: foot or feet inward with toes pointed downward and heel drawn upward. Treatment: gradual straightening, cast, and splints. So rarely would this require surgery. This can be solved pretty easily by the use of splints and gradual straightening and the use of cast. So pretty simple to take care of. Osteogenesis imperfecta. This is abnormally brittle bones. leading to fractures. Cause, it's an inherited mutation, frequent bone fractures, blue coloration of sclera of eyes. So it's one of these signs of typically the white part of the eye would be have a blue coloration to it. Treatment, there's no cure to it. It's a tendency for bones to fracture often disappears by adulthood. Hydrocephalus, this is an abnormal accumulation of cerebral spinal fluid in the brain due to abstraction. Causes, congenital defect, infection, tumor. Symptoms, there'd be a rapid enlargement of the infant head and bulging of the eyes because it's filling up with this cerebral spinal fluid. Tight scalp and prominent head veins, shrill, high-pitched cry. Treatment would be surgical correction with shunt placement. Typically, a shunt would be put in to one of the ventricles, typically the lateral ventricle within the brain, and there could sometimes be an outside shunt, but a lot of times it's shunted down to the heart to try to drain out the fluid. Another thing on hydrocephalus, the reason why you'll see hydrocephalus with children is because their bones in their skull haven't calcified yet. So, as you know, many of you have had children, you've been around or work with children, their head is still moldable. This same thing happens with adults, but because our brains are calcified and solidified, this would just increase the intracranial pressure. So there wouldn't be this dramatic physical appearance, but would still be dangerous. The same with the increase of the intracranial pressure. Cerebral palsy, another neurological disorder. This is a congenital bilateral paralysis. And you'll see, you'll see this on both sides of the body. Cause, inadequate blood or oxygen supply to the brain during fetal development, birthing process, or infancy. Symptoms, hyperactive reflexes and rapid muscle contraction. This is a common thing. This is very common, and this is with any, and this is kind of just a good thing to kind of take with you. If you see this when you're working with someone, and it's not always apparent with neurological conditions yet what the source of it may be, but if you see hyperactive reflexes, it's always something involving the brain or the spinal cord. So it's an upper motor neuron, what they'll say, or a central nervous system disorder. And so if you saw someone with hyper reflexes, then it's upper motor neuron problem. They also have rapid muscle contraction, muscle weakness with scissor gait. So they'll have a very distinct kind of look and movement to them. Treatment, physical and speech therapy, orthopedic cast, braces, and surgery, anticonvulsants and muscle relaxants as needed, and there's no cure for it. Spina bifida is a congenital disorder, opening in the spinal column. You can see this bulging, this outpouching here. Cause is unknown, but the risk factors include maternal radiation, virus, and genetic factors. Symptoms differ with form of disease, and forms of a spina bifida, forms of spina bifida, there are a few different types: spina bifida occulta, meningeal seal, myelomeningeal seal. And it's really just the difference is the location of it. And so you can see here this spina occulta, the kind of the way it looks, this meningeal seal, kind of this outpouching, and then the more severe type. So this is probably showing a myelomeningeal seal on this infant here. Treatment would be surgery. Huntington's disease, like we were talking about earlier. A genetic defect of chromosome 4. Cause, genetic, if one parent has disorder, 50%, the child then has a 50% chance of 50% chance in the offspring. So if someone had this disease, very likely, uh, if they had children, that their children are also going to have it. Symptoms: behavioral changes, unsteady gait, and then increasing dementia. Treatment: no cure, medications to reduce symptoms. Now looking at cardiovascular, we have congenital heart defects. Heart and related vessels are most common sites of congenital defects. You probably know someone who, or either a family member or a friend who had congenital heart related problems. My sister-in-law was born with a hole in her heart. It's a very common disorder. Defects can range from small to quite large. Collectively, these malformations are called congenital heart defects. Unknown, but genetic tendency is strongly suspected. And looking at symptoms, vary from mild asymptomatic to extreme with cyanosis, breathing difficulty, and heart murmurs. Diagnosis will be through an electrocardiogram and physical examination. Treatment: early diagnosis and a surgery to correct whatever the defect is. And so, someone who, in the case of having a hole in their heart, there's a few different pathways because of fetal blood circulation, that there are these natural, um, for the fetus, a natural pathway that they have, that because they're not breathing on their own, they don't need blood to go to their lungs to bring in. So there's sort of this natural hole within the walls of the heart. Now, when we take our first breath, typically the pressure from taking that first breath when we're born will actually close these holes. But in certain cases, they don't close. And so if they don't close, then um, now that the child has to get oxygen in on their own, will cause problems and issues. So we're looking at the first type. We're looking at an atrial septal defect. So this is one of the holes of the heart. So if somebody says they were born with a hole in their heart, or maybe we know someone who has, this is one of the probably the more common one. But this opening between the right and left atria, it's a failure of the septal tissue to form between the atria. And typically this would close immediately when someone was born, but someone with this defect, it wouldn't close. A foramen ovale not closing at birth. So if it didn't close, it would be referred to as patent. Patent means open. Foramen ovale, or PFO. Causes increased workload on right heart. You could also have a ventricular septal defect, most common heart defect, hole between the right and left ventricle. So similar to atrial septal defect, but down here in the ventricular, between the ventricles. Whole blood shunted from left to right, causes increased workload on right heart. So you can see both of them are going to increase the workload on the right heart. Blood here is going to go to the lungs. So increased workload to the right side of the heart. It's also going to lead to pulmonary hypertension. There is also a patent ductus arteriosus. And what this is a connection between the pulmonary artery and aorta. And this is normal. As I was saying earlier, you don't need to send much blood, or really any blood, but some will get there. You don't need much blood to go to your lungs when you are not getting oxygen, when you're breathing, when you're a fetus. But this should close naturally when we're born, but in certain cases it doesn't. Blood shunts from the aorta to the pulmonary artery. So in this case, let's say this ductus arteriosus, this passageway does not stop or does not close off. When the heart contracts and left blood comes out through the left ventricle, it'll come up through this aorta and should go out to the rest of the body, the head, the abdomen, down to the feet and arms. But what will end up happening is that because this is open, because of gravity, it's going to pull it back down into the pulmonary circulation. So it's going to increase blood into that pulmonary system. Again, will lead to pulmonary hypertension. And with that, you'll have increased fluid and difficulty for them to breathe within the lungs. Coarctation of the aorta, a stricture or narrowing of the aorta, causes increased pressure proximal to the narrowing. You can kind of think of it as like putting your thumb over the opening of a hose. So if you turn on the hose or turn on the water faucet, the water comes out the hose. Put your thumb over it, it's going to increase pressure that it is coming through. And that's going to increase the overall workload of the heart. Tetralogy of Fallot, one of the most serious congenital defects. It's a combination of 4 problems. So pulmonary valve stenosis, right ventricle hypertrophy, so the muscle of the ventricle will get bigger and thicker, ventricular septal defect, and abnormal placement of the aorta. Now looking at the blood, you have sickle cell anemia. It's a chronic hereditary form of anemia, predominantly affects the black population. It's a sickling. The blood, a red blood cell has a normal shape to it, and the sickling shape kind of looks, when it's abnormal shape of the red blood cell, that makes it look more almost like a boomerang rather than the normal kind of almost donut type appearance to it. Hemophilia, it's an X-linked hereditary disorder passed from mother to son. So similar to other pathologies we've seen, in which you will see this disorder in males. Digestive disorders, both genetic and developmental, range from mild to severe. Many are diagnosed at birth, and some are incompatible with life and must be corrected immediately. Developmental malformations. Several developmental malformations occur in the digestive system. Causes unknown, might be related to genetic tendencies, or could be related to maternal risk factors. Maternal rubella, poor maternal nutrition, smoking, alcoholism. Digestive or developmental malformations. You have Meckel's diverticulum. It's an outpouching of the diverticulum of the ileum. So you can see this outpouching here. What will happen is that fecal matter will then get stuck in these outpouching, causing increased inflammation and pain and risk for infection. Esophageal atresia, abnormal esophagus. So you can see here a few different types of abnormalities that you may see. And congenital diaphragmatic hernia, which is a hole in the diaphragm causing a hernia of the digestive contents through that hole. Imperforate anus, failure of the anus to connect to the rectum. Cleft lip is a fairly common one. One or more splits in the upper lip affects boys more frequently than girls, and treatment is through surgical repair. Cleft palate, more serious than a cleft lip, involves the roof of the mouth. So you can see how it extends into the mouth itself. You see here, with the entire roof of the mouth, there's almost a non-connection between the two sides of the maxillae. Treatment would be surgical repair. Pyloric stenosis. So right here is the stomach, and the final portion of the stomach before contents in the stomach go to the duodenum of the small intestine is the pylorus. So it's a natural narrowing of this area as it goes down into the small intestine. What happens in this case is that you have hypertrophy of that pyloric muscle, so it narrows the lumen here, so it obstructs the flow of food out of the stomach into the small intestine. Common anomaly of the digestive tract, symptoms, projectile vomiting, and treatment would be a pylorotomy. So just a removal of the pylorus altogether. Hirschsprung's disease, absence of nerves in the segment of the colon, usually the sigmoid colon. Our digestive tract has its own set of nerve supply which controls the normal, what's the word? This would cause peristalsis. That's the word. This nerve supply would allow for that normal movement, starting in the esophagus all the way down through to the anus, would allow for that movement. So in this disorder, you have an absence of the nerves responsible for that peristalsis in that sigmoid colon, which is one of the last segments of the large intestine. Symptoms will be chronic constipation and abdominal distension, because basically what would end up happening is that it would get to that point and then it would stop. The movement would stop, so the person would get completely backed up with fecal matter, and it would lead to this pain or these symptoms. Treatment would be surgical removal of the affected segment. Temporary colostomy may be necessary to allow adequate healing of the colon. Fetal ketonuria. This is a genetic disorder involving faulty metabolism of protein phenylalanine. You'll see a warning on this, particularly with diet sodas or diet drinks. Diagnosis by blood test 72 hours after birth. This is mandatory in the United States, so it's kind of a part of the normal blood work done on children. Lack of treatment can result in mental disability. So if this isn't caught and this amino acid is in their diet, then it would lead to mental disability. If it is caught early on, and since this is mandatory testing, then through diet this can be avoided. So now looking at some urinary disorders, you have hypospadias. You have abnormal congenital opening of the male urinary meatus on under surface of the penis. You have chordee, which is abnormal fibrous band of tissue resulting in a downward curvature of the penis. Epispadias, which is an abnormal congenital opening of the male urinary pedis on the upper surface. So if it's epi, it's going to be on the upper surface of the penis. Hypo is going to be on the undersurface. Causes of these conditions are unknown. No treatment to surgical repair. Wilms tumor. This is the most common solid tumor affecting children and infants. Cause is thought to be genetic, highly malignant, usually replaces one whole kidney. Symptoms asymptomatic until large enough to feel in the child's stomach. So this would continue to grow in size. And like uh, with most cancers, chemotherapy and surgery would be the treatment options. Looking at reproductive, you have a cryptorchism, which is a condition of undescended testes. This can be one or both of them are undescended. Um, Turner syndrome, this affects females. Ovaries are absent or are abnormal or absent. Cause is a chromosomal disorder. Females have only one X chromosome in this disorder rather than the normal two X chromosomes. Symptoms, failure to develop normal secondary sex characteristics, and treatment would be enhanced growth in secondary sex characteristics with hormone therapy. But that would be limited as their genetic makeup still wouldn't have the second X chromosome. Klinefelter syndrome. So you can see the kind of, here we're looking at some more genetic and sex-linked genetic disorders. So Turner syndrome, you're looking at just one X chromosome. And the Klinefelter syndrome, you're looking at an extra chromosome. In this case, an infected male having this extra X chromosome. So affects males, do not develop secondary sex characteristics, cause this chromosomal disorder with this extra X, and the extra X could come from the ovum from the female, from the mother, or it could be from an extra X from potentially from the sperm as well. Symptoms, not diagnosed into puberty due to abnormal male sexual development, sterility, abnormally small penis and testes, general appearance of a eunuch, tall, slender body, and long legs. Treatment would be testosterone treatment and psychological counseling. Autism, a developmental disorder characterized by difficulty communicating and informing relationships. Cause is unknown. Symptoms, blank facial expression. That's typically in some more severe cases of autism. Involved with self and inaccessible to others. So they're kind of in their own their own world almost. Treatment would be behavioral therapy and depends on the severity of the symptoms present. And as we're kind of learning more and more about autism is such a huge spectrum of a developmental disorder that it presents so differently from each patient, each person who has autism. Stuttering is a developmental speech disorder, also known as stammering. Often when children's speech and language abilities are unable to meet the child's verbal demands. Symptoms, there'd be hesitancy of starting and finishing words and prolonged pauses between words. And the treatment will be behavior modification and positive reinforcement. Multi-system diseases and disorders. Hereditary disorder that affect all exocrine glands. And if you remember, exocrine glands are those that are released on an outside surface or onto the outside surface of the body. And so that could include inside the lumen of the digestive tract would be considered outside the body. Cause, hereditary recessive disorder. Symptoms, affects all exocrine glands leading to viscous secretions. So you would typically what the disorder that you'll see with this is excessive mucus buildup inside the digestive tract, and then what affects them primarily and what usually ends to the loss of their life is this excess mucus and buildup along their pulmonary tract, leading to their lungs. Treatment would be postural drainage, chest clapping, antibiotics, bronchodilators, expectorants, and oxygen. This would be every day and multiple times a day for their whole life. The use of this postural drainage and chest clapping. Down syndrome, also called trisomy 21, a condition of having 3 chromosomes instead of 2 in the 21st position of the chromosome chain. Symptoms, mild to severe mental disability, and then you can see some of the abnormal, distinct look that they will have. Treatment, highly individualized to maximize mental and physical abilities. Trauma, or one is a failure to thrive. This is a lack of physical growth and development in infant or child. You can also sometimes see this you'll see this in adults as well. Physical and or psychological. Metabolic pathologies and GI pathologies are some common causes. Deformities, possibly milk allergies, parasites, asthma, UTI, heart disease, failure to produce enough milk, insufficient feedings, caregiver actions. So it could be either pathology with the system or in the environment that a child is in. Symptoms, weight loss or failure to gain weight, anorexia, vomiting, diarrhea, irritability, and a ragdoll limpness. Fetal alcohol syndrome. This is a group of symptoms and birth defects when born to a mother who consumed alcohol during pregnancy. Varying degrees of mental disability, decreased physical development, irritability in infants, hyperactivity in older children. Microcephaly, which is a small, abnormally small head. Increased incidence of ventricular septal defects and lifelong behavioral difficulties. Congenital rubella syndrome, transmission of rubella virus to unborn fetus, can cause spontaneous abortion or major birth defects. And then you can see some of the most common defects here. And then prevention will be immunization, no pregnancy for 3 months after immunization. And then some rare diseases. Anencephaly, this is absence of brain or cranial vault, not compatible with life. And so typically this would be, obviously the child would be unable to live in this case, is that the brain or cranial vault does not form. Achondroplasia, this is a decreased long bone growth leading to a type of dwarfism. And Tay-Sachs disease, a genetic error in lipid metabolism resulting in accumulation of toxins in the brain. Okay, next we're going to go a little bit further into pediatric pathology. Infectious diseases, they're going to fall into these 4 major categories: viral, bacterial, fungal, or parasitic. Symptoms can be wide-ranging, but these are some common symptoms. And then treatment, obviously it varies according to the disease. And so it could consist of symptom relief, good nutrition, rest, pyuretics, antipyretics, or and then also good hand washing. Viral diseases, usually symptomatic treatment, invade host and can lay dormant, reactivated by certain triggers such as stress. Measles, one of the most serious childhood diseases, commonly spread by contaminated airborne droplets. Symptoms would be fever, runny nose, red maculopapular rash, which you can see here, and Koplik spots. You see those Koplik spots are these white clustered lesions on the buccal and mucosa. Rubella, it's a type of measles, also known as German measles, in pregnant women may lead to birth defects less contagious than rubella. Symptoms will be lymph node enlargement, nasal discharge, joint pain, chills, and fever. And children and women of childbearing age should be immunized. Mumps, it's an inflammation of the parotid glands. So you can see her very swollen appearance to the neck and face. You see the common symptoms, complication, orchitis, and nerve conduction deafness because of the amount of inflammation in the area, cutting off conduction of sound. Varicella, also known as chickenpox or herpes zoster, highly contagious. Symptoms would be a classic rash that develops into vesicles, rash on the face, trunk, and extremities. And treatment of it now is sort of changed. I know growing up, it was sort of, if one child had varicella, had chickenpox, you kind of would just put them all in a room together. Let's get them all chickenpox while they're young, so then uh, so they don't remember having this painful um, disorder. Typically, it's highly contagious, but it's typically not life threatening. It's just very uncomfortable. Um, but there is an immunity to it once you've had it. But now they have vaccinations, um, which can then protect the child from getting it without having to do that. Poliomyelitis causes be the polio virus. Immunization has reduced threat of disease, so we don't really deal with polio anymore, or with new cases of polio, at least in the United States. There's still some third world countries which do, and then there's another condition called post-polio syndrome, which you may have some older patients who have that you may come across, but it's something that should here at some point um, be wiped out and should be a disorder we don't really look at anymore. Influenza, acute infectious respiratory disease, occurs in late fall through early spring, and some early symptoms of it being sudden high fever, dry hacking cough, chills, headache, joint or muscle aches. And then prevention would be vaccination, and depending on the flu particular virus itself, it has varying levels of efficacy of the vaccination. So sometimes it could be as low as 30%, which does protect some of the population, but doesn't have a very high effective rate. Common cold, most frequently occurring disease caused by the rhinovirus, and prevention is through good hand washing. Mononucleosis, this is primarily affects children and young adults. The virus is the Epstein-Barr virus. Symptoms will be a fatigue, sore throat, fever, and swollen lymph glands. And this typically lasts for several weeks and even sometimes up to several months of this feeling of fatigue and this sore throat and fever. AIDS has now affected thousands of children. Cause would be the HIV virus. Most cases result from maternal fetal transfer, and children suffer symptoms and often are orphaned. Treatment focuses on prevention. So some bacterial diseases, pathogens that are common: Staphylococcus, Streptococcus, Haemophilus, Clostridium. Symptoms you can kind of see here, and then treatment based on causative agent. Pertussis, this is also known as whooping cough. You've heard of that before. There's a few different stages of symptoms. Catarrhal stage is inflammation of the mucous membrane, usually in the throat and nasal sinuses. Paroxysmal stage, this is intense whooping cough and cyanosis, because there's difficulty getting oxygen to the body, so you start seeing blue in the fingertips and maybe even the toes and other regions. And then convalescent stage, gradually less frequent cough. So you can see kind of this early increase in inflammation, the proximal stage being more the intense stage, and then convalescent stage, kind of the gradual less frequent cough. Diphtheria, this is severe inflammation of the respiratory system, was a leading cause of death in children and now is rarely seen due to vaccination. Tuberculosis, also a bacterial disease, most commonly affects the respiratory system, but can be systemic to bone, brain, and lymph nodes. Increasing number of cases in children. Tularemia, also known as rabbit fever, transmitted by a bite of infected insect or direct contact with an infected animal. And then prevention would be avoiding tick bites. Impetigo, this is a contagious superficial pyoderma. And so what you see is typically you'll see it around the mouth of children. And so this bacteria along their mouth causing pus on their skin causes usually Staphylococcus and group A Streptococcus. And prevention would be good hand washing, good hygiene in general. Acute tonsillitis is an infection of the palatine tonsils located on the posterior wall of the nasopharynx. Cause would be commonly group A beta hemolytic streptococci. Symptoms: sore throat, enlarged tonsils. Treatment would be antibiotics and a tonsillectomy. Otitis media, it's an acute bacterial infection of the middle ear. Untreated chronic infection develops. And so important that if this infection is suspected, that it's treated. Treatment is with antibiotics and occasionally with removal with the tympanoplasty or to relieve fluid pressure. Fungal diseases, they affect skin or the mucous membranes in children, sometimes more common in infants. Usually not severe, but it's irritating. Candidiasis, also known as a yeast infection, common in infants' mouths and called thrush, and in diaper area called diaper rash. Cause be oral fungal infection from delivery, unclean rubber nipples, and antibiotics even. And then prevention, we breastfeeding, diaper rash treated by keeping the area clean and dry. Tinea or ringworm, so you can kind of see the ringworm appearance here throughout that this boy has throughout his body. Group of diseases, you have tinea capitis, you find in the scalp, tinea pedis, which is ringworm in the feet, or tinea cruris in the groin and scrotum area. They can occur in several different locations. Parasitic, looking at some more the parasitic diseases caused by organism that feeds on another organism, most commonly found in places of poor nutrition, contaminated water, and low socioeconomic conditions. And then only a few common in the United States. Giardias, infection caused by protozoa from the Giardia lamblia. Young children are most often affected, and protozoa lodge in the lining of the small intestine. Risk factors from dogs, travel, and contaminated water. And then you see some of the symptoms there. Pediculosis, infestation of lice, transmitted from human to human direct contact, and epidemic commonly amongst school children. And then treatment with this permethrin You can see how kind of the eggs attach to the hair, and then later on, um, then lice will then hatch from these attached sites. Pinworms, it's a parasitic nematodes that infect intestines and rectum, transmitted by ingestion or inhalation of eggs from an infected surface. Symptoms: the anal itching. Worms appear as tiny white threads. Roundworms found in soil. So if you have kids who are out eating dirt or putting sand in their mouth, parasites lodge in the intestines, and what you'll see is abdominal pain, gas, pneumonia, possibly, and spread by hand-to-mouth activity. And then, like with most parasitic type creatures, they will then absorb nutrients from the host. So there's potential for malnutrition from the child. Respiratory disorders, most common childhood diseases seen by a physician. Children are very vulnerable due to continuous person-to-person contact, and then infants being the most susceptible. You have sudden infant death syndrome, or SIDS. This is an abrupt, unexplained death of infant under age 1. The only symptom is death of unknown cause in an infant. So hence the name. It's unknown and very abrupt, and obviously very tragic. Croup, or tracheobronchitis, upper respiratory infection, affects children ages 3 months to 3 years. Adenoid hyperplasia. This is enlargement of the pharyngeal tonsils. May require an adenoidectomy. Adenoid is just it's another word for tonsils. So if you ever see that. Asthma, serious chronic respiratory disease in children. Symptoms are acute coughing, wheezing, and shortening of breath. The triggers are some sort of stimuli. So sometimes it could be exercise related, or could be pollution, could be something that inhaled, could be exacerbated by stress. Pneumonia, this is an infection of the lung parenchyma, or the functional part of the lung. Cough, fever, wheezing, malaise. Treatment would be antibiotics if bacterial, and if viral, it will then just run its course within 5 to 7 days. Children may experience serious development problems due to lack of appropriate ingestion, digestion, absorption, or elimination. With digestive diseases, fluid and electrolyte imbalance frequently more severe in children and may be caused by vomiting and diarrhea. Colic is a common symptom of digestive problems, GI pain, crying, and irritability. Fluid imbalances coming from cause could be vomiting or diarrhea, can be serious, and if the dehydration progresses far enough, will be life-threatening. Food allergies, most often in children under age 1. Most common allergies are cow's milk and eggs, and many disappear by the age of 5. If allergy develops after age 3, it usually continues into adulthood. Eating disorders, major problem among children, especially adolescent females. And the most common types would be anorexia nervosa, bulimia, probably the two most common types of eating disorders. Most cardiovascular, so now looking at cardiovascular diseases, most cardiovascular diseases in children are related to genetic or developmental disorders. Common in children due to high activity level. Looking at musculoskeletal diseases, range from soft tissue injuries and fractures to joint and bone deformities or degenerative muscle disorders. So a few of them, there is a disorder called Lay-Calf-Perthes, or LCP. This is avascular necrosis of the upper end of the femur. What that means is that the blood supply to the head of the femur will be cut off. So basically, the head of the femur will, the cells and the base of the bone will die. Causes changes in bone growth. Untreated, it may lead to permanent deformity. Ewing sarcoma is a malignant neoplasm occurring before age 20, usually in long bones, more common in males, and quickly metastatic and highly malignant. Blood diseases. Leukemia is a malignancy of the blood-forming cells in bone marrow. Most common disorder of blood and blood-forming organs in children. Symptoms would be pallor, bleeding or bruising, fatigue, joint and bone abnormal pain, abdominal pain. Treatment would be among the most curable diseases of childhood cancers and chemotherapy. Neurological diseases, we have Ray's syndrome. This is an acute encephalopathy in children under age 15 who had a viral infection. The cause is unknown, but there is a relationship between the disease and the use of aspirin for febrile illnesses in children. Symptoms would be nausea, vomiting, liver enlargement, lethargy, and seizures, coma, and in many cases, death. Eye and ear diseases have profound effects on children's ability to learn and develop. A strabismus is a lazy or cross eye. Deafness causes could be genes, trauma, infections, and exposure to ototoxic drugs. Child abuse, very serious problem in the United States, unfortunately, often fatal. And then there will be emotional, physical, and or sexual harm or neglect. Emotional abuse harder to diagnose than physical abuse. Sexual abuse occurring in epidemic proportions. Suicide is the third leading cause of death among young people. Prevention would be early intervention, most important, kind of reducing the amount and level of trauma. Drug abuse, illicit drug, alcohol, and tobacco use, an epidemic problem among children, especially adolescents. Poisoning, among top 5 causes of accidental death under age 10. And most poisonings due to common substances found at home, such as cleaning products, medicines, and plants. Okay, and that wraps up our slide um, for this. If you have any questions, please reach out to me and I'll be happy to answer them. Thank you.